And the profile on those young people is quite amazing. They are not risk takers. They protect their friends from risk-taking behaviour. Hardly any of them smoke. They have good relationships with their parents, all the protective factors. They have stayed in schooling. They have bank accounts. They abhor violence. They have plans for their future. And we're talking about children who were in the disadvantaged group. And for most of them, they have had a number of adverse life effects. So what we can say with confidence is that the hippie effect persists throughout primary and intermediate school, which is exciting because we say goodbye to them at age 6, and at age 12, they're still well ahead of their peers, particularly in literacy. There's also a great deal of evidence to show that the family environment changes. Parents are more likely to participate in their children's schooling, while mothers, especially those who've been paraprofessional tutors, are more likely to enter further education and employment. They tend to study early childhood education, and these are women who would never have seen themselves capable of it. I want to give you one example of this profundity of change I'm talking about. Now, I have permission from this South Auckland mother to tell her story. This woman she's the mother of 6. She's had 3 children removed from her custody. Imagine the misery and imagine the cost to the state. She was recruited into hippie with her youngest child. She was complaining to her home tutor that the child was dumb, this 4-year-old. He couldn't talk. The tutor suggested that he would start to talk if she talked more with him. The mother looked at her in surprise. "Well, you've had 8 kids. Did you talk to them?" "Yes, I did. We had conversations." The mother went to her own mother, who was in the kitchen, because this mother lives in the sleep out. Or no, she lives in the garage. She went to her own mother, who was in the kitchen, and she said, "Do you know what? We're supposed to talk to them." This mother of 6 tried it. It worked. She's happy. She's proud. She's looking forward to her child going to school because she knows this one will do all right. And of course, she's created a relationship with him. Hippie coaches parents in the lowest SES strata to create a home environment that in one key characteristic is more typical of a high SES home. That is, in the number of words a child hears spoken in his or her home. There's superb research on this matter, particularly the work of Hart and Risley. Our greater than $1 billion expenditure on teacher-led, centre-based early childhood education cannot do for children of hard-to-reach families what hippie parents do for no pay. That is, talk with their children enough to enable them to enter school with essential skills for success in literacy. Parents did it, not people with degrees. Returning to our hippie mother for a moment, her hippie home tutor, the one with the 8 children, is now chairperson of her school board of trustees. A nearby school in the same hippie district, Otara, has 4 hippie parents on the board of trustees. Another school principal on the other side of Auckland in West Auckland says hippie is the backbone of his school. 3/4 of the board of trustees are hippie parents. This is empowerment before our eyes. So why is our outreach successful to so many hard-to-reach families? It's partly the content of the program, as I described it. It's the system, alternating home visits with group meetings, thus building the community networks. And it's the relationships between parent and child, between parent and home tutor, between tutor and coordinator, between parent and coordinator, between parent and parent, and between coordinators and our national staff. I heard Kay Brereton of the Wellington People's Resource Centre the other day telling Catherine Ryan that what people on benefits need is to be treated with respect, empowered and encouraged. She said, we've got to value them for the contributions they actually can make. This encapsulates beautifully the ethos of hippie. What works in 27 locations in New Zealand could work in 50 or 60 or 70. Australia saw what we were doing a few years ago. They are on their way to hippie in 50 locations around Australia, funded by the federal government, which has addressed itself to just what this forum was convened to do. Moreover, that rollout in Australia has drawn heavily on our New Zealand materials and systems. You can imagine how galling that is. So we can reach hard-to-reach families. We can create lasting positive change. It is cost-effective on multiple levels. Nothing is more imperative on the fiscal level or on the moral level of creating equity than empowering parents to be loving, connected, effective parents, enjoying the honey of knowing that they're making a hugely significant contribution to their children's future. All we need is the political will. I have a few other recommendations, and all of them are controversial. I'm sorry, but I am a bit of a red rag waver, so I think we need to gain a better understanding about the realities of the lives of parents and children. Look with clear eyes. Now, I know the concept of research irks some people, but I think we're suffering from our failure to do some sensitive, respectful, listening research in, say, one or two communities where, among 20 or so households, it's possible to gain an understanding of their lives and needs, their material situation, their histories, their aspirations, the obstacles to those aspirations, and especially note the realities of life for the children. And this would help us avoid the pitfalls of either overestimating or underestimating parent capacity. We should reinstitute the home visiting role of public health nurses. Yeah? That was a bad move and relates very much to the material circumstances that I was talking about. We need to prioritise access to family planning advice and services, especially for those families who cannot keep their heads above water through the effect of repeated unintended pregnancies. Some of these women are drowning. They are submerged. We need to ensure that the lead maternity carer contractual requirement to offer contraceptive advice is met, and ensure that strengthening families is alert to this need. We need to help young people. Now, this is an underserviced group. We need to help young people choose a positive trajectory for their lives. We need to use a public health approach to encourage young people to plan a life path that avoids early pregnancy and the greater likelihood of long-term relative poverty and benefit dependence. We need to re-examine our official nonchalance about family structures to explore whether, in fact, good intentions have had unintended consequences. The connection between family structure and family function has been no-go territory in Wellington for some years. I think the time has come for some exploration of the data. There's a woman called Dr. Kay Bradford. I think she's died, sadly, a Nelson child psychiatrist. She said in 1988, "Never before in our history have so many teenagers had babies because it has never before been tenable. Now it's half tenable in that the DPB and antibiotics usually ensure that the baby will survive physically, but mentally it's a different matter."